Hello, my name is Dr. Shahryar Khezri. I'm an anesthesiologist and a cosmetic injector, part of the Allure Aesthetic and American Academy of Cosmetic Medicine. The first topic we're going to talk about is about neurotoxins or neuromodulators. Neurotoxins or neuromodulators are number one procedure done in the world of aesthetics. The use of the neurotoxins in medicine goes back to 44 years ago, but in the aesthetic world, about 20 some years ago. In the world, there are about more than 20 companies, different companies, that they produce this neurotoxin, which not all of them are approved by the FDA. There are 6 major ones approved by the FDA in the US. Number one is BOTOX, second one is Dysport, then it's Xeomin, Juvo, Daxxify, and MyoBlock. MyoBlock is only used for the medical purpose treatments, not in the cosmetics. So we have just 5 major brands that they use in the cosmetics: BOTOX, Dysport, Xeomin, Juvo, and Daxxify. BOTOX is a multinational company, majority based in the US. Dysport is made in England. There are the 2 major products that they use in the US market. In reality, when it comes to the treatment, every 1 unit of Botox in terms of the potency equals 3 units of Dysport. Botox and Dysport, they both are the best products that we have. 3 most common areas that patients get the treatment with these neurotoxins are the glabellar complex, which is in charge of making a frown, forehead muscles, which is in charge of raising eyebrows and making wrinkles on the forehead, and the crow's feet area, which is orbicularis oris muscle around the eyes, as a part are in charge of making those crow's feet. This is about 95 to 98% of the patients. Many different elements come into play when you want to decide how to treat someone with the Botox or Dysport. How strong the muscles are, how tall or how wide the forehead muscle is, and how much activity you can see in those muscles. Treating these areas involves multiple injections with the very small needle that we use. It's a 31, usually 31 or 32 gauge insulin syringes, and it's very painless. People barely notice any pain when we inject. These medications usually come as freeze-dried, so we have to add saline to them to make them liquid to be able to inject. So the first immediate reaction that you're going to see is a little teeny tiny bump in the area that you inject, and that bump or little teeny tiny raised wheels that we make underneath the skin is the effect of the saline. The body will absorb the saline, and Botox or Dysport will stay there, and it starts affecting after a couple of days. Most common side effects are headache that usually causes either is caused by the needle or by the medication itself. If we go very heavy on the forehead, there is a chance that we may cause the eyebrows to become heavy and kind of drop. Or in very rare occasions, it can happen that the medication leaks into the levator palpebrae, which is in charge of lifting the eyelids. And if that medication leaks into that muscle, it'll cause the weakness of that muscle, and it causes the eyelid ptosis, which is not very often, 1 over a couple of thousands. So I hope this information would help you, and I hope to see you soon in any of our locations: Seattle Plastic Surgery, Northwest Face and Body in Kirkland, or the Gallery of Cosmetic Surgery in Linwood. Thank you so much.